Tyler.
And then there's Chuck, who just adores the kids, you know, the Tuck, and he's the one. Who are your favorites?
Bronco and Night Fury.
From what movie?
How to Train Your Dragon.
My name is Pilar Jaramillo, and my son is Daniel Jaramillo, who also has a very healthy sister, Alex. And we're from Virginia, and our story with Danny, as far as kidney donations and liver donations, and the importance of having donated organs available, is that my son was born early, premature, because they found that his kidneys were not working in utero. So we had an emergency C-section, and we were able to save him, which is really rare. He was very, very ill for a long time. He didn't come out of the NICU for 4 months, and then it was in and out until they did a nephrectomy at his ripe old age of 7 months. And then he did okay, and he was able to reach his goal for height and weight by the time he was 18 months to go ahead and get a transplant. His father gave him his transplant, donated an organ to his son, a kidney, but because he had autosomal polycystic kidney disease, there was a lot of complications with the liver and the spleen and other organs. His lungs were very, very small, and they've developed, but they still have their issues. They're spongy. But something was missing in the first surgery insofar as how to control it so that he wouldn't reject. A little bit less than 2 years later, my son violently rejected his donated kidney, which was very difficult for the whole family. And then we found UPMC, Children's Hospital, by luck and by grace. He was listed here for liver and kidney, and he was listed back home for liver and kidney, and miraculously on February 5th we had received a phone call to come up that there were 2 organs that matched Danny, who was a very hard match because of the rejected organ. When we got here, the surgery ended up being finished on the 6th. It was quite a long surgery, and he was not able to receive the kidney. So he's now on hemodialysis, still listed for his kidney. And it's really important because he's gotten to the point where he now is requiring hemodialysis to survive, which is very hard in a 5-year-old to be tied to a machine. And even though they're excellent here, Danny's gotten the best medical care I've ever seen in the world for him. And we're very grateful, but organ donation is just huge because it's very possible that even I, as his mother, may not be a match. And while we're going to start all that in place, we're praying and hoping that their kidney will become available for Danny immediately so that he can have a normal life and enjoy the things that his sister enjoys. Danny is a wonderful 5-year-old boy. He's extremely intelligent, and as most children that are transplant patients, he's extremely intelligent and very aware of his surroundings. He's small for his age because of the kidney issues, doesn't allow for normal growth, but his mind is compatible with a 30-year-old's. He is active, vivacious, loving, loves his nurses. He loves life. He wants to do things. He wants to play football. He wants to play soccer. He wants to play. We've settled on golf. Everybody here is wonderful. The liver transplant team is just, the dynamics of the team in and of itself is wonderful. The way they're cohesive. They're a family. They work together. Dr. Cindy, Dr. Mazariagas, Dr. Bond, Dr. Soltis, they're just incredible. I mean, each one has their beautiful, beautiful side to them, and each one of them has their specialty. Dr. Soltis can talk to Danny in a manner and reach him in a manner that very few physicians I have seen get there with him. Dr. Cindy reached him last week to the point where he was literally sitting on him and letting him rub his belly, and through that he was doing his exam. Dr. Cindy is, I couldn't even imagine to be as smart as maybe one of his fingers, you know. Dr. Mazariagas, right, he just lights up a room and is so brilliant. Dr. Bond lets you know how it is. He doesn't mess around, which is great because you need to know where you stand and what's going on with your kid. You know, no sugarcoating, just let you know, and in that time help you out, and as a parent he understands what you're going through. And they're just wonderful, and his dialysis nurses are, in my opinion, and we've been around the block, the rock stars of dialysis. You know, they're just incredible ladies. And if there were a way to donate an organ to my son or to any child that needed it, all I needed is a phone call. And, of course, the spare ones. I've been an organ donor since I was able to, and our family basically is pretty much all into that. And it was before we even had our child, because organ donation saves lives. And if you do want to kind of live forever, that's the way to do it. For all those people that want to hang on to things because they might die or they might this. Well, the way to live forever is to donate a life to somebody else.